And thank you for watching today's Community Update. I'm Angela Stepp, Director of Communications for WSOT TV and Sunnycrest Baptist Church. In just a moment, you're going to hear from local leadership important information pertaining to the COVID-19 outbreak. Now, today's broadcast will be re-aired here on WSOT TV at 5:30 p.m. and at 10:30 p.m. and then additionally on Sunday, April the 19th at 10 a.m. and at 5:30 p.m. all here on WSOT TV. It will also be made available for online distribution and through local media outlets. Joining us today will be Bob Jackson, Grant County EMA Director, Mark Bardsley, Grant County Commissioner, Mayor Jess Allenbaugh, City of Marion, Colin Gibson, who is the Vice President of Operations for TLC Management, Dr. Moore from the Grant County Health Department, Sarah Evans from Marion General Hospital, and then by phone we will be joined by Rick Ferrant of Northeast Indiana Work, and you'll want to hear what he has to say. Up first, you're going to be hearing from Bob Jackson, Grant County EMA.
Thank you, Angela. Good afternoon. I'll bring you up to date on what we have been doing at the Grant County Emergency Management Office and what we call our Emergency Operations Center. We are in our 35th operational period. What we do each day is we review our plans from the prior day, see how things went, if we had to tweak anything there, and then we look for, we reassess, look for what's coming at us in the next operational period, which usually is a day for us. We break them up day at a time. So that's what we have been doing. That's how we have tried to manage all the stuff from the emergency side of this pandemic and how we protect the county and plan to do so in the future. The other thing we do is, because we are part of District 6, we're one of 13 counties in District 6, we also reach out to our partners in the other counties, see what resources we can share if we need to, how we can help one another. So Grant County is well protected, we're well prepared. This extra time that we've been given because of the many efforts, really good efforts at social distancing, physical distancing, has bought us time to prepare our PPE, our personal protective equipment. We've made great strides there, and being better protected and better prepared for a second wave should that come, or anything in the future that may come our way in the near future. So as we look forward to, there again, we reassess, we look at what's doing. So as we look forward to trying to figure out when we could start releasing some of the restrictions, and we'll have conversations with the commissioners, with the health department, with the CDC, with the state health. A lot of people will help us make those decisions when it is appropriate, when we think that that's safe to do. So we will follow through with that when we do. Also, initially, we are looking long-term. So for the next maybe even couple months at this point, because we know this is not going to go away anytime soon. We still have to plan and prepare for the summer months that are just around the corner. Even though it is snowing today, summer is right around the corner. We want to be prepared for that and what that will look like for the county, and how we prepare from an emergency management standpoint. So that's where we are. That's what we've been doing. We have no plans to change our operation at this point. We'll continue to operate just as we've had with the health department as the lead agency. We get our direction from them when we look and reassess the situation each day. It's based really on what the health department, what the CDC tells us on how we are progressing and how the spread is progressing. Okay? So with that, that is all I have. Thank you, Angela.
Thank you so much. And next we will hear from Grant County Commissioner Mark Bardsley.
Thank you, Angela. On behalf of the Grant County Board of Commissioners, as well as elected officials throughout Grant County, thank you for your continued support in observing the governor's stay-at-home order that has been issued during this pandemic crisis. Grant County's vigilance and early reaction to this disaster has actually helped us reduce the transmission of the virus in Grant County. Last week, I reported that news media was indicating to us that over a flu period, which is approximately 6 months, that the average of 5 years, we lose about 150 to 160 individuals during that 6-month time frame of the flu season. Over a 4-week period during this disaster, we have lost over 170 in the state of Indiana. And so what we want to reinforce with our population here in Grant County is that we are seeing a difference because of the physical distancing that we're doing, because of all the proper hygiene that we're working on. And we look forward to what the governor is telling us each week, and I believe he's going to make a press conference even today at 2:30. Encourage you to be listening to what the governor is saying in the State Department of Health. If you want to follow with that, you can go to in.gov on the internet and make sure that you are updated. The Indiana Department of Health is giving information and at their website, and we want to encourage you to follow along there as well as what's going on in the county. If you need to do business with any of the county offices, please feel free to call 668-8871, and that will get you to the main switchboard that gives you a list of all the different departments. As well, you can go to the grantcounty.net website and find your particular department that you need. You can email, you can call. Call forwarding will get you to some of our folks, and we'll make sure that we help you through this time of crisis. I want you to know that we're making informed decisions for the future. We're not going to base anything on fear. We're going to do it on facts. And some of the facts that we do need to say is that travel is still restricted, that we're asking folks to stay sheltered in place. Indy recently announced that their peak in the Indianapolis area is probably at the end of this month, maybe into the 1st of May, and then they're saying that the surrounding counties will peak about 2 weeks after that. We've seen different models that have said that the 14th or the 19th was going to be our peak here locally. We're still waiting because this is a fluid situation, and we need to be following what the CDC as well as the Indiana Department of Health is giving us. So again, we want to encourage you to continue to do what we've been doing. We have seen a reduction, and it's hard to prove a negative, but it just makes sense that because we are distancing ourselves, because we are helping to prevent transmission between individuals, that we are seeing a reduction in what we thought would be not only the sickness, but even our mortality rate. One thing I want to share with you as we finish up our portion is Scripture says, "Let us not be weary in well-doing, for at the proper time we will reap a great harvest if we don't give up." That means we keep doing what we do, and we thank you for your active participation in doing that. Keep the hygiene up. Keep washing your hands. Keep that physical distancing, and we are going to beat this. We'll continue to give you updates over the next couple of weeks, let you know where we stand, not only in the county, but with the state, and we want to encourage you to be strong, be safe, and be steady. Thank you.
Thank you, Commissioner Bartsley. And next we invite City of Marion Mayor Jess Allenball.
Thank you, Angela. First, I want to thank Sunnycrest Baptist Church and WSOT-TV for doing this every Wednesday, taking time out of their busy days so we can keep you informed there, you citizens of Marion and Grant County. For the City of Marion, not much has changed in the past week. The Transportation Department is still running the buses, but only with 24-hour notice and only taking passengers to pharmacy, grocery, medical appointments, only those essential needs. If you're going on the bus trying to get to a friend's house, you're not going to get dropped off there. Also, something we have to address right now, because even though when I came in just now for the taping of this show today, it was snowing, sooner or later spring and or summer will arrive here in Marion. And we already noticed that there are yard waste being collected around our community. Right now, we're not picking those up. I want our employees to stay home as much as possible. We want to honor the president, the governor, and their orders to keep our distance from each other. And it's very difficult to do that when you're working. So we will get to that just as soon as we feel like things are a little safer. Again, We know social distancing is the key, so we're trying to adhere to that at City Hall and throughout the city government. Also, I want to encourage you to go to your restaurants, get carry out. If they can deliver, have them deliver. We really need to support our local businesses. They are facing a very difficult time right now. The more we can support them, the more we can help them get through this very difficult time. So please, utilize those restaurants for your food. Also, I want to remind you that the park equipment throughout our city parks, all the playground equipment is off limits during this time until further notice. City Hall is going to remain closed through the end of this month, or at least until further notice. Let me say that. It'll be until further notice, until we feel it's safe for us to congregate together like we have in the past. We don't know when that day is. I've noticed it's very quiet around the city compared to what it normally is. I want to thank the citizens of Marion for adhering to this stay-at-home initiative. We know that that's the best avenue to beat this virus, is to kind of distance ourselves for this time. If we'll do that, we'll get through this. And finally, I want to encourage you to continue to pray for our healthcare workers and our first responders. They are right out there on the front line. You're going to hear from a few of them here in just shortly. Also, our restaurant workers, postal workers, FedEx, UPS, all these people that are still out there working at these essential places here in our city that they don't have a choice. They're asked to come into work every day. Keep them in your prayers. And finally, I want to encourage you to join me every Monday through Friday at 7:30 in prayer time. We've been doing that at City Hall since January, the first Monday of January 2016. We start off every work week with prayer. I ask that you pray for me for wisdom and discernment. God put that on my heart from the very start. That has never left me. Wisdom and discernment. I need that. Pray for our other leaders throughout the city and the county for wisdom and discernment. But every Monday at 7:30, you can join me from your homes, wherever you're at, and lift up our community leaders in our community, Marion and Grant County, and God will get us through this. Thank you.
Thank you, Mayor Allenbaugh. And next we'll be joined by Dr. Brad Lindsay, Superintendent of Marion Community Schools.
Thank you, Angela. Around town, the community foundations put out their signs that say, we're in this together. I see it at Marion General. I see it at College Wesleyan Church. I see it all over the place. I love that. It's more than just a saying. When we think about us as individuals and just in our own hand here, each finger is so important and unique. But by ourselves, we're vulnerable. But boy, when we come together tight like a fist, we're ready for the fight. And that's what we're up against right now. This coronavirus is evil. The economic crisis that's following it is evil. And we can't fight evil with evil. We can't fight hate with hate. We fight it with love and action and doing good. And so that's how we defeat together, coming together. And I'm so proud of our community for coming together for this fight. We're up for the fight. We're going to fight together. And when our community fights, we win. And that's what we're doing right now. When it comes to our schools, thank you, families, for reaching out and connecting with teachers and social workers and principals, connecting with us. Thank you, students, and us with you. That's so important to keep that communication, connection. That's how we help each other. Thank you for doing so. Continue to do so. If you cannot get a hold of a teacher, please communicate with the principal, and we will meet your needs. We'll connect with you. A week ago was our food distribution. Tonight we have food distribution. A week ago, it went great. 35,444 meals were served. Families, thank you for coming in and help getting the food out there. We were a little concerned last week with our masks and our gowns that it got hot and how we might overheat. Problem solved for this afternoon. It's snowing, it's icing, and it's windy. We won't overheat today. 4 o'clock to 6 o'clock is our food distribution. This week we had our first home learning packet pickup. Thank you for coming in. 1,500 packets, grades preschool through 8th grade, were picked up. That's over half of our population there. Thank you, families, so much. We ask you to continue to stay connected, stay united. We are up for the fight, and we will win.
Thank you, Dr. Lindsay. Next, we will be joined by Cullen Gibson. He is the Vice President of Operations for TLC Management, and we invite him to come and share with us today.
Good afternoon, everybody. My name is Cullen Gibson, and I work at TLC Management. here in Marion, Indiana. I've been here 21 years in this lovely community, and on behalf of the healthcare workers that we employ here in Grant County, I want to thank all of you who are watching this for your support and your prayers for our healthcare workers and our residents in our facilities. This has been a pandemic that has hit us and challenged us beyond any other type of flu or virus we've ever experienced in our facilities. On behalf of Colonial Oaks Healthcare Center, who I'm speaking about today, our facility there on South Marion, we just got word as of yesterday that we had a resident test positive for COVID-19. We acted quickly once we found out the test was positive. We moved this lovely resident into our isolated area in our facility. We have 17 facilities that we operate in Indiana and Florida, and 2 weeks ago, we went out and created isolated COVID-19 units for these residents that unfortunately are in those units because of the positive test. We acted quickly on this resident at Colonial Oaks. Our staff there are prepared. We have plenty of personal protective equipment. We are well-staffed. We have great leadership. We are following all of the direction that is given to us by the local Grant County Department of Health and Indiana State Department of Health and the CDC guidelines. Our staff is trained for this. They're prepared for this. We feel having this isolated unit is a huge decision we made at Colonial Oaks so that our other residents are protected. And I want to tell you that our employees who work that unit stay on that unit. It has a separate entrance and exit at Colonial Oaks. And again, just please pray for our staff there at Colonial Wesleyan Healthcare Center, also in town, and Rolling Meadows Healthcare Center in LaFountain. Please lift them up in your thoughts, and thank you for the donations of what we call PPE. Thank you for your prayers. Thank you for your vigilance. Family members, please continue to stay close to your phones as we are sending out messages from Colonial Oaks, mass messaging and videos to keep you updated. Please contact Colonial Oaks at 674-9791 and talk to the leadership there. They can update you on your loved ones there. Right now, we feel that we've got this under control. Again, this is a very, very evil, fast-moving virus, and we're doing everything we can under the power of God and grace to keep this virus from spreading any further at Colonial Oaks. Thank you, and any questions, please call Colonial Oaks. And I do have a hotline number here that's dedicated for Colonial Oaks, and I want to tell you what that number is now. It's 1-888-852-7400. Press option 2, and that's our dedicated hotline for any questions you might have about COVID-19 and what is happening at Colonial Oaks. Thank you.
Thank you, Colin. I appreciate it. And next, we will be joined by Dr. David Moore and Amber Turner from the Grant County Health Department. I welcome you onto the platform.
Thank you very much. We are here today. We've been coming for several weeks now on a Wednesday to give information. The idea, my commitment was that we would keep the public informed, that there was misinformation being given on social media, people being scared and everything else. Doesn't mean that this isn't a bad disease, but I want you to understand that we see it, we know it, we have a plan to deal with it. When there's information to be had, good information, bad information, that you can count on us to share that information with you. And I thank Colin for coming today and share that in our county, this is the first time that it's happened. This probably won't be the last one. This is a bad, ugly disease that's coming. This is not your everyday flu. This is a real disease that is coming and making people sick and is causing death. And that Grant County has had it come, but I think that because of the leadership that we've demonstrated, starting with Bob Jackson and all the way down through the leadership in government and hospitals, our first responders and other people, that it's been a condition that we've managed. And I think that we've reduced the numbers that have occurred. That it's happened happen in a nursing home, at a facility, that there is a plan that Colonial Oaks and that the entire system has had for when this occurs, what are we going to do? And how are we going to work as a team, not as individuals? How are we going to work as a team to begin to deal with this and to keep our community safe? The people who are on the front lines, what they're doing and how they're doing it. And what we've seen is that the numbers do and continue to increase, but they're not increasing at the rate that they were before. We haven't peaked. It is not time for us to go back to business as usual. We need to continue to stay with this. The one thing that has worked the best that we know is social distancing. I called it physical distancing before, but us keeping our spaces apart from one another and reducing not just the spread of it, but perhaps we're going to reduce the number of those who get sick. There will be other treatments. We will know. There will be things that we may tell you this week that we may learn by next week that are different, but we will give you the best and most current information that we have and how to do it and how to stay on top of it and how we're going to deal with it. When someone is infected, when someone is positive for COVID, there is a plan that we have for dealing with that. And Amber, our nurse at the health department, is going to share with you what we do to try to make sure that if you are involved or someone else that you know involved, how we as a system have come together to try to deal with that. Amber.
Thank you, Dr. Moore. I just want to thank you for letting me be here today, and we still want to encourage everybody to continue their universal precautions, their distancing from each other. If you're sick, stay home. But also what Dr. Moore had mentioned, if we are notified of positive cases and we have guidelines as far as that have been set from the CDC and the Indiana State Department of Health that we follow as the infectious period, that we contact individuals that may have been in contact with the positive case. So lab confirmed cases are all reported to the health department. If it's a clinical case that did not receive testing, we will not receive those names of individuals. But if we do have a positive case, we will be in contact with individuals that are considered as close contacts as the guidelines set by the CDC and the Indiana State Department of Health. So if you do have concern that you have been in contact with a lab confirmed positive case, you will receive a call from one of us at the local health department, be one of the nurses, if not myself, the other staff that's there working alongside with us. So I just want to reassure everybody that if you have been in contact with someone, you will hear from us. Thank you.
Thank you.
Thank you both very much. Next, we will be hearing from Marion General Hospital Representative Sarah Evans.
Thank you. I'm Sarah Evans from Marion General Hospital, and we just wanted to provide an update that to date, Marion General Hospital has collected approximately 325 specimens for COVID-19 testing. Of those tested, less than 10% of those individuals have actually tested positive for the virus. And of the 10% of those individuals that have tested positive, approximately 30% of them have required ventilator support for their treatment or recovery. We are pleased with the improvements in test result turnaround times. We are now seeing test results being able to be to patients in approximately less than 3 days. And as we strive to meet our patients' needs while working to conserve our personal protective equipment, we have been utilizing iPads in the FaceTime application. This has really allowed our staff to continue to have face-to-face interactions with our patients while trying to reduce the usage of our PPE and the number of times that we have our staff required to put on gloves, gowns, and face masks to enter into the patient rooms. We have successfully utilized the FaceTime application to interact with our patients, to help with selecting their meals, checking in on them with our nursing secretaries, and then to address any questions or concerns they may have that they would normally use to call their call light. We can do a FaceTime visit with them and find out what their needs are. The patients and staff have found this to be really beneficial and an effective way to have indirect contact with one another, but yet still having the ability to see one another and have that interaction. We're so appreciative and gracious for the donation that we received from Moorhead earlier today. We had a delivery of 30 iPads to our community that they donated to assist with patient, family, and caregiver communication, and we want to say thank you. There will be also the next blood drive coming up with Marion General Hospital, Meyer, and the South Bend Medical Foundation, and that will be held on Monday, April 27th from 1 to 6 p.m. That will be at the Marion Meyer parking lot. You can schedule a donation time by going to givebloodnow.com and searching for Marion Meyer, and the time slots will be published so that you can choose a time that suits your schedule to be able to donate. Also, details of the blood drive are available on the Marion General Hospital Facebook page. Again, just a reminder that blood product is low during this time, and if you are able to donate, we would appreciate your opportunity to do so. And I just want to say today that on behalf of Marion General Hospital, its leadership, physicians, and staff, we want to express our sincere appreciation for the kindness of the support, the donations that have been extended to our hospital. This has truly been a time of our community coming together, and we have seen and felt the sense of community over the past several weeks. We want to assure you that we are here to continue to be your healthcare provider of choice as we face COVID and beyond. Thank you.
Thank you very much, Sarah. And I want to remind everyone, again, what she just said, the website, if you would like to be a blood donor, that need never goes away. The website is givebloodnow.com, and that's where you go to schedule your appointment to give blood. And again, that is givebloodnow.com. One more time, givebloodnow.com. Now we have a guest joining us by phone. His name is Rick Ferrant, and he is with the Northeast Indiana Work. Now, Rick is coming on air with us now. Rick, are you joining us here? Are you with us?
Yeah, I'm here. Yeah, can you all hear me?
Welcome. What would you like to share with our viewers today?
Well, first I want to thank you very much for giving me an opportunity to share some unemployment and employment-related information, and also want to commend everyone in Grant County for helping people safe. Sounds like you're doing a great job. At the outset, I'd like to share the unemployment situation for Grant County through April 4th. Unemployment figures for the week ending April 11th will be released tomorrow, and we anticipate another significant number of initial unemployment claims. In the 3 weeks between the middle of March and April 4th, 2,280 people in Grant County filed initial claims for unemployment benefits. The largest volume came in the week ending March 28th, when 1,091 people filed claims. The manufacturing industry and the accommodations and food sector have led the way in workers filing claims, and that's pretty much consistent with every county in Northeast Indiana. Obviously, as we've heard, the retail industry has also been hit hard. All unemployment claims have to be filed online with the Indiana Department of Workforce Development, and that can be done through unemployment.in.gov. Offers an array of information, links, and contacts. The unprecedented surge of unemployment claims statewide, there were 42,279 during the 3-week period that I mentioned. And that swamped the department and has led to difficulty for many people filing claims. The department has been working to improve its response capacity, and things should get better. But I know that it's been terribly frustrating for folks to get through just to file a claim and also to have questions answered. As many of you already know, our 11 Work One Northeast Career Centers, including the one in Grant County, are now closed indefinitely, or as we say, until further notice. But our staff continues to work from home with employers and existing customers. And there's a hope that virtual tools will be coming online that will enable Northeast Indiana Works and Work One Northeast to resume some services that have been suspended. The Department of Workforce Development is working on virtual workshops that would replace the in-person sessions the centers provided. And we have added an employment opportunities page to our website at neinworks.org that lists employers who are hiring in Northeast Indiana. The employers' names are linked to the company websites, and the list will be updated weekly. People can also go to IndianaCareerConnect.com to search for job opportunities, and I know the Growth Council in Grants has also been listing jobs online. The interesting thing about this situation we find ourselves in is that while many employers have been laying off workers, many employers, including in Grant and surrounding counties, are still hiring. So for those who were unemployed before the virus outbreak, there's opportunity. For those who were employed and laid off, how one reacts is a personal decision that I can't in any way provide guidance on. There's simply too many variables. But I know these are some tough decisions that people have to make. The current openings run the gamut of skills and experience. There are too many to mention here, but a very quick sort of cursory look at hiring employers now in Grant County include Culver's, ResCare, Cafe Valley, 5-Star Senior Living, Meyer, Securitas, Marion Utilities, Family Service Society. There's several trucking companies, and then Marion General Hospital. In fact, Marion General will be participating in a Futures in Healthcare virtual job fair we've arranged for 10:30 a.m. April 22nd that will also include 4 other healthcare providers in Northeast Indiana. And you can access the registration for that virtual job fair by going on our website. Again, that's neinworks.org, or on the Work One Northeast Facebook page. There's been a significant amount of interest from healthcare providers in this virtual healthcare fair, and it's quite possible that we'll do a second one after this one. We'll have to see how it goes. There are also a lot of companies hiring in counties surrounding Grant, including but not limited to Docol Packaging, American Axle, Bungie, Trilogy Health Services, Peyton's Northern, Eagle Care, Homestead, and then some temp agencies like Leader Staffing are doing some hiring for production positions. Again, I want to thank you for the opportunity to briefly address the unemployment and employment landscape, and I wish everyone the best as we collectively maneuver through all this. And I should add that people can still call the numbers for the Work One centers, leave a message, and a staff member will get back into touch with you just as soon as possible. Thank you.
Thank you. And again, that web address that he said you could go to file your unemployment claims, it is unemployment.in.gov. You can also go, if you're looking for employment opportunities, to the Work One Northeast Facebook page. That's the Work One Northeast Facebook page. And we want to say thank you to Rick Ferrant for coming on and sharing that information with us. Well, as we conclude today's community update, I want to remind you that it will be re-aired this evening at 5:30 p.m. and 10:30 p.m. here on WSOT TV. It will also be rebroadcast on Sunday, April the 19th at 10 a.m. and 5:30 p.m. here on WSOT TV as well. And it will be made for distribution online through your local various media outlets. And I want to encourage all of you to stay tuned for some more quality family programming that you can trust right here on WSOT TV. Thank you.